the hookup culture is like from 13, 14 they have started. Does this also impact the vaginal health, the uterus health, and in turn, rise of infertility when they're actually looking for child?
See, most of people do not know that the vagina is a self-cleansing organ. So when they use these products, which they try to sort of improvise on their own from their friends, from the magazines, from the videos that they see, and they use these extraneous products, which can change the bacterial and the vaginal flora, is what makes them susceptible to infections. I try to avoid sort of prescribing a tablet which is going to make them mess up their ovarian cycle.
Welcome to the Life Grids conversation. Today, the topic that we have taken is kind of a taboo. We are going to talk about vaginal health and the uterus health and why these have challenges today. The fact that the infertility issue has been the highest, whatever we have seen till date. Why has it increased? Both the men and women have contributed to the infertility. But there are a lot of reasons, environmental, you can say electromagnetic smog, and there are so many external factors. But the cultural things, lifestyle has definitely changed. And has that impacted the infertility in women? So this is the focus discussion that we are going to have with Dr. Prakash Kini. It's been an honor and a pride moment for the Life Grids team here to have you and to discuss on this topic of cultural shift which has led to the infertility issue.
Thank you, Krithika, for getting me on board here. First of all, you mentioned it as a taboo subject. I don't think it's a taboo subject. I think it should be overwhelmingly clear to every lady and a guy to know what exactly sexual health is about, and so that they can prepare themselves for the onslaught in the years to come. Point number 2 was when you mentioned that the flow of things which is happening in the present generation has not deviated. It has been there for years and centuries, but it was kept under the wraps. Now things have changed for the better and it's more open. So therefore we can see it more clearly, and the manifestations are there for us to implement the treatment that are needed to solve the mysteries and the myths about sex and taboo topics as such.
However, the number of infertility clinics were not as much as today it is.
Yeah, I agree on that because previously, we had a lot of yellow boards which were the ISD and STD booths. That was about 25 years ago, before the mobile generation started. And then came the Xerox shops. Every person who had a garage and who had a free space, they always had Xerox machines which were from taking prints and copyings, etc., etc. These days, it is the fertility clinics that have sprung up. If you see in our territory itself in Jayanagar, you'll find across the road, you'll be finding more than 3-4-5 fertility centers which are just sprung up overnight.
Exactly.
And they are busy. They are not sitting idle and waiting for patients to come. The patients are flooding these centers and giving them royal business. So fertility is the in thing these days.
So when you said it was then, that time also, 20 years, 30 years back also, the problems were there, but the percentage have changed.
They were, one point I would say here that infertility was something which was not discussed openly in the families or with their peers as such. But nowadays, most of the patients, let's go backwards this way. Most of the people are now educated, the ladies. They definitely have woman power as such. You saw the World Cup being won by Harmanpreet and Smriti Vindana and company. And they are now being paid as much as the men's team of almost 50 crores for having won the World Cup.
Yes.
So going this way, we find that the males who were sort of having a king's seat as such is now having a companion who is at par with them.
Yes.
So infertility per se may be restricted to 35% being the female being involved. 35% would be the males who are responsible, and a combination of both would be roughly about 30% who would make them infertile.
Okay.
Symptom-wise, problems-wise, from both the companions will sort of be the deciding factor as to what is the cause of infertility.
Okay.
So having decided that woman power is up there, most of the ladies are now educated. They definitely have a career that they look forward to.
Yes.
They look at career advancement as such. And by the time they settle down into an office wherein they would like to be climbing up the ladder as such, they're already 29, 30, 31. Then they find the right partner. And these days you have a lot of live-in relationships as such. They try to see if they can go ahead with this partner or not. And having gone through and they find that, okay, this guy is okay or this guy is not good, drop him and pick up the next one. They're already advancing in age.
Yes.
So they are now touching 33, 34, 35. And then finally the family clamps down upon them and they get the right guy and they get them married off without even knowing what has been happening in the past. Here comes in a new family and you find that they are definitely have a say in the matters of what they should decide to when to have the babies. And they say, okay, let's settle down in a married life for a couple of years and then decide to get pregnant.
Yeah.
So that increases the span of time and they're already now touching 36, 37, 38. And by that time, they decide, okay, enough is enough. It's time to have your babies. So between the ages of 38 and 40, 42 is when the most of the patients these days come to the clinic having got a pregnancy test positive.
Okay.
And with ChatGPT and www and Dr. Google there to guide you along, you find that it's not difficult for them to grasp what the situation is.
Okay.
And they do not get the correct information which is individualized as such. It's just general knowledge information. And that may be a dampener at times because it may not apply to them. And therefore, having gone through certain videos and, DIY kits as such, and then they still don't get pregnant, then they finally approach a doctor.
Okay.
And most of the times, they go from doctor to doctor, which is not the correct thing to do. It's ideal to stick to one person and get the treatment sorted out and ask questions as to why things are not falling in place.
Right.
So most of the times the patients are running from pillar to post trying to get a jackpot hit the first attempt itself, which is not feasible in day-to-day life. So there's a lot of patients who move around looking for the proper fertility person to help them conceive. So there's a big bandwidth that you have from the age of the time they pass their graduation, post-graduation, jobs, career advancement, marriage, then deciding to get pregnant and then look for a baby. It's now touching beyond 35, 37. 40 years ago, when I started practice, it was 25 plus age group where they would have got married, they would have had 2-3 kids back to back, get a sterilization done, and they are settled down in life. And then they decide to concentrate on the babies and make them grow. And it was a familial setup as such. Now there is nuclear families. Most of the parents are somewhere else and the children are in some other city because of the job profile or maybe because of the, processes which gets them to climb the ladder faster. So you may be based out of Bombay but working in Hyderabad, or you're in Hyderabad and working out of Delhi. Or if not, the pastures abroad are also calling them to their place and trying to set up their office space there.
Yeah.
And then comes the international barrier which comes in, and again they have problems trying to get adjusted to the lifestyle, to get the partner properly, and then go for a marriage or pregnancy.
So now what you're seeing is
A
between
shift.
35 to 40 is where they come to.
Commonly. So
Commonly.
between minimum, I would say between 32 to 38 is the window of people aiming for a pregnancy.
But the right fertile age is somewhere around 23 to 30.
25. So the nature has seen to it that the best eggs are put forth in the earlier ages.
Okay.
So when you attain your sort of menarche at age 14, 15, 16, and then they start menstruating regularly and they are now ovulatory as such. So by the time they are 18, 19, 20, their genital tract is fertile for a pregnancy to take place. So that's the time when the best eggs come forth. Okay. And as you grow older, the depletion of the good eggs leaves only the bad ones left behind in the ovaries as such. So by the time you're 30, 35, midlife as such, if you see of the reproductive age group, you find that the best eggs have been pushed forth. Okay. And only the ones which are not up to the mark quality eggs wise. For example, when you go for infertility, they classify the eggs as A, B, A, C, B type of eggs as such, C type of eggs. And these are the ones which are not very sort of conducive for a pregnancy. So the ideal age, if you ask me, would be between 28 and 38 to get pregnant and have your babies.
Okay.
After 38, we feel little uncomfortable. Our antenna go up. We need to do more investigation to see that nothing goes wrong with the pregnancy and that the baby is a healthy one which is growing inside.
Okay. So now that we know that it is going to be only 35 plus, there is one thing which is very popular also, egg freezing. Does this really work?
Well, egg freezing does work, and I have a few patients who are very quite rich and well off, and they are not getting the right partner for them to be proceeding there in the life, and so marriage is in the back burner. But they are now anxious about the fact that they are now growing older,
Okay.
so they come to the clinic to retrieve the eggs, which we pick up and freeze it and sort of keep it in the safe custody. So as and when she gets married, she can or gets a right partner to have a baby, those eggs can be sort of defrozen or thawed out and fertilized with the sperm of the partner and then impregnated on the lady to have a IVF protocol.
When is the best age to freeze? You said 23 is the 23 to 24
I mean,
best.
I wouldn't worry about it at age 23, but definitely I would worry about it at age 38, 40.
But you also said when it is 30 plus, the eggs are not that great quality. So the best quality eggs are available only between 23 and 25 or 28.
But why do you want to go through a process which involves sort of invasion into the peritoneal cavity, into the ovary to retrieve the eggs? When you can get your partner, if you're quite bold enough, you can decide upon your partner between the age of 25 and 30 and get the natural way.
Okay. So too early planning is not
needed at all.
Now that you know that you are 30 plus, that is when you may have...
I wouldn't even say 30 plus. I would say 35, 38 plus when your eggs are going to be totally depleted.
Okay.
So that is a time when you may consider, because eggs are available all over the world. You have donor eggs which are there. So in case you really run out of eggs, you can always use a donor egg for an infertility procedure as such. These are costly, but you do not know where the eggs have come from. And therefore you sort of retrieve these donor eggs from in a fertility bank and then fertilize it. It's just like, equivalent to suppose somebody has to go through a surgery, say let's say open heart surgery like a cabbage, and you require 4 to 6 bottles of blood. You definitely go to a blood bank and you pay whatever amount is needed for, get four bags of blood, the blood bags as such, and give it to the surgeon concerned. He runs the blood through during the surgery. Patient recovers. You don't even bother where the blood came from.
That was considered normal, but this having first of all the coitus and all these things was so divine, and having a getting pregnant itself was a divine act.
Correct.
And having a baby is such beautiful thing. But all these things have now deduced into have a plan B, donor, and all these things. It has come.
True.
So it is a clear one. Yes, we are getting empowered. We are doing things that we were not able to do. All these things great, but then still a woman as a creator, we would still, whatever we achieve, there's a motherhood, there is that craving, and that is what to an extent makes us feel complete.
Yeah.
That is definitely, how much ever you are ahead in your career, the motherhood is a feeling that cannot be even explained. That is a feeling that only can be experienced, not explained. And the need for that. And now this career pushing all these things is putting us into a very technical discussion. It is like, okay, let me freeze my egg. This was something not known. And it is also going to cost, which was nature had given, and it is a beautiful relationship. Now it is coming into the line item.
So it's like, so many people who are fond of mangoes or jackfruit, during the season, they preserve it in the deep freeze, and when the time comes and you want to relish a mango, you just pull it out from the fridge, thaw it, and then eat it. But that doesn't taste as well as the fresh ones which you bring from the market. So similarly, we tell them that, look, this egg freezing business is there. That's the last option for you. You can definitely freeze at a cost. You must be geared up to pay for it. But you can save your genetic workup as such and keep it frozen as such for a better time at a later date. So if you're not sure about yourself, well, try to make it up and try to see that if you can get pregnant in the meantime through a partner of your choice, and then go ahead.
Is it has become, from years you've been seeing, has it moved from an emotion and other thing to all more is it like a milestone, me having a baby, or is it still the same emotional?
So, Krithika, here I would say that there is a percentage of population who says, look, we are married, we are comfortable, we are happy, we don't want to have kids.
Okay.
So there is a percentage, say about 10% to 15% who these days I'm seeing, look, we are not interested in kids. We just want to be comfortable and just see that we pull on our life and get going. Maybe we can take an animal as a pet and then keep it at home and we are comfortable. Maybe a dog or a cat or whatever it is. And these people, they are not even thinking in terms of having a parenthood.
That's fine.
Yeah, but that is their priorities. We don't bother about them.
Yes.
The second group is those people, the girls who feel that they must meet Mr. Right. And until you meet Mr. Right, they are left out. So for them, they do come to us and say, we want to freeze our eggs. And if you got the funds for it and the capability to sustain that frozen eggs for a period of time, go for it.
Okay.
We don't say don't do it and get married. The marriage is not the answer.
Yes.
But if you want to maintain your genetic markup and your profile as such, freeze your eggs.
Okay.
Worst case scenario, if you don't still have any good eggs left, you have donor eggs, which will sort of substantially help out in the pregnancy process.
Okay.
So also the male, if you find that they are azoospermic or having low counts, we have donor sperms which will definitely have a positive pregnancy effect taking place for the mother, for the lady.
Okay. Since you mentioned a couple of times that this is going to cost really high, approximate what are we looking at to freeze egg and how frequently should we do it?
No, I mean, you can harvest the eggs, we stimulate the eggs, ovarian stimulation is done. And the ovum pickup is done, it's called as OPU. This is done in a semi-sterile theater by a qualified person under ultrasound guidance.
Okay.
So we pick up the eggs and freeze it. We put them in liquid nitrogen and try to freeze it around 190, 183 degrees Fahrenheit. And they are all stored as such.
Okay.
And when the time comes, they are thawed out and fertilized in vitro and then implanted in the uterine cavity of the mother or the lady whose donor eggs were there.
Okay. So while we saw almost the career as the reason and to find Mr. Right as the reason for the
there is certain things as you age also. You have a lot of medical problems which creep in. You have polycystic ovarian syndrome, you've got endometriosis which is becoming rampant these days, you've got fibroids growing. And all these things sort of are deterrents for a pregnancy, natural pregnancy to occur.
Yes.
So as you grow older, if the uterus is not stimulated to a pregnancy, you find there's a tendency for fibroids to develop. These are benign tumors, but they keep growing each menstrual cycle. They don't wait dormant and sit quiet and say, okay, I won't grow any further, but they do grow. So over a period of time, these fibroids start enlarging in size and giving rise to symptoms of heavy bleeding and, pain and dysmenorrhea and all those things, which makes them come to the hospital, look, I'm having these symptoms. And when we get a scan done, I said, look, these are the fibroids which are growing. You may require a tablet to control the growth of it. Or if not, if it's too large, surgical intervention wherein we do a myomectomy and get rid of the fibroids. Okay. So this is also quite common these days.
So now we spoke about three major reasons. One, the career. The other one is to find Mr. Right. The other one is a genuine medical reason.
Yes.
For whatever reason, they had that thing. There is now the environmental reason also.
That comes in last. So you find that those ladies who are highly stressed out, I mean, lifestyle has become too stressful for everybody concerned, whether it's the traffic, whether it's the pollution, whether it's the job profile, whether it's the manager who's sitting on top of your head, the timelines that you need to do, and working right through the night and getting up late and, not seeing sunrise or sunset as such, sitting cooped up in AC rooms, all these things, and the fast life as such, you work 5 days of a week and the 6th and 7th day you let your hair down, party,
exactly,
pubbing and this and that, and maybe driving out, whatever it is. And this lifestyle is keeping them comfortable till they find, okay, now it's time for me to sit up and think about what next. So this is a common trend that most people come with the history of. Okay. Stress goes hand in hand with diabetes, hypertension and polycystic ovary.
Okay.
Major cause for endometriosis also is late marriages, late pregnancies, and then you find that the stress levels hampers their pregnancy as such.
Okay. So, doctor, we kind of categorize the three major reasons for rising infertility challenges. One, the career. The second one is Mr. Right, finding them, it takes time. And the third one is the genuine
medical problems.
Medical challenges. You've also seen how the cultural lifestyle shift while doing all these things, the hookup culture, the younger people exploring the hookup culture is like from 13, 14 they have started. Does this also impact the vaginal health, the uterus health, and in turn, rise of infertility when they're actually looking for child?
Um, 3-4 things are involved in this. As you rightly said, they want to experiment. There's a lot of peer pressure which comes in. Suppose you take a PU college and there are some, say, 60 or 100 students in them. Most of the boys would like to sort of express themselves in a fashion that they are the ultimate. The young girls fall for it. And if you go past Vijaya College as such, you will see all those guys zooming on bikes as such, just trying to impress the girls as such. Fine, that's okay. Most of us would have.
I thought those were all in 80s and 70s. Even today,
they still have the same scenario as such. But the point is that those days in 70s and 80s were different what is in 2025 and all that. They are much more bolder in experimenting. They definitely have sort of late night parties. They go out, and most of them are in the hostels who come down to Bangalore, to a major metropolitan city from outstation, where there are no restrictions, there are no curbs, and the nightlife is quite young to go about as such. And therefore you find that people are experimenting, and 2-3 couples get along and they freak out as such. And the pub culture, if you've seen, is just multiplied maybe 10x as such. And you find that there is a lot of hard cash which is easily available for these people. So to spend is not at all a difficult proposition. So they definitely would like to have a good time of their life before marriage as such. So that is what is maybe instrumental in causing upheaval in their sexual health in the long run. So they are sexually active. They are aware of contraception, and the pharmacies across the city do dole out drugs as such without even a prescription. And in case they do miss the period, they know that there's a pill that is available that will sort of help them out in these cases of disaster. And finally, the pills that are there, even if you do get pregnant, abortion is not at all a difficult proposition. And since it's legal in India to get an abortion done till the age of 24 weeks gestation, so they don't sort of wait that long, but they get the termination of pregnancies done, which they know is like, just going to a coffee shop, ordering a coffee and say, having a coffee over a period of time and walking out paying the bill.
Okay.
So it's quite easy for these youngsters to have access to clinics, to pharmacy, to material, to information. And with the rampant age of, clips that are moving about in Insta and, your Tinder and all those things, and Twitter, you find that there are plethora of outlets to sort of let go. So this is definitely causing more, problems for the genital health as such per se. They are more prone to infections, and if they have multiple partners, it becomes disaster in the making. And when they do have abortions, it definitely sort of impinges on their uterine health and tubal health in the long run.
Okay. This conversation is not to judge or not to say which is right. It is their own personal choices, whatever they're doing. But this lifestyle, how much and what impacts the vaginal and the uterus health? What are things like now they use a lot of products on their vagina to smell good or douching and steaming, all these things. They do it because, again, peer pressure, and this is the expectation. While these are looking so harmless, how does it impact the girl's health?
See, most of people do not know that the vagina is a self-cleansing organ. This happens because of the pH of the vagina, which is very, very acidic in nature.
Okay.
The pH varies between 4 to 4.5 as the pH.
Okay.
So when they use these products, which they try to sort of improvise on their own from their friends, from the magazines, from the videos that they see, and they use these extraneous products, which can change the bacterial and the vaginal flora, is what makes them susceptible to infections.
You're talking about the microbiome.
Yeah, microbiota and the vaginal health as such.
Okay.
So the vaginal health for every lady is maintained unless there's a break in this health.
Okay.
By, say, for example, you have tears, you got abrasions, you got surgery done, or you are a poor health responder as such, you are on immunosuppressants, you are a smoker, you are an alcoholic, and you are maybe diabetic or hypertensive, not in this age group, but as you grow older, you're perimenopausal. So the entire vaginal health is based on the general condition of the patient. So basic thing what you should understand is the vagina is a self-cleansing. It does not require any extraneous products to be inserted or used to protect the health of the vagina. There's no need to have nutritional supplement for the vaginal health.
But almost these children, the younger thing from, I would say, from 14 to 24-ish, when they're experimenting more than understanding their body, they're just exploring. They wanted to smell good, and this odor is something which they don't find it very attractive. And while that is the age, they wanted to also be attractive.
Correct. So there are people who tell us, so I've been using this wash, I've been using that wash, and still I have no response. And I said, that is not needed as such. You have to smell good, but just thing is to have a regular, normal bath and then keep yourself as clean as possible. So this is what predisposes them to infections like fungal infection. Candidiasis is quite rampant. More when you use unwanted antibiotics for small sort of illnesses. Number two, you are sexually active with multiple partners. You find that these infections do creep in. And the general health, if you don't eat much healthy food as such, try to sort of restrain yourself from eating good things and stick to cups of coffee one after the other and snack in between and not have a nutritional meal as such, you find that the deficiencies do occur. And most of us know that we do your vitamin D and B12 assay and all these things and say, oh, I'm D deficient. And I agree, that is there because that's because of your lifestyle, that you don't eat proper food
that is
on
diet
time.
And nutrition.
Yeah. So there you find that if you are nutritionally at par, you will never have a vaginal infection unless some predisposing factors are attacking the vaginal epithelium to get you into a infection mode. The vaginal epithelium has got what are called as squamous cells which get desquamated, and there's lactobacillus in the vagina which converts the glycogen into lactic acid. And this lactic acid is responsible for the pH to be between 4 and 4.5. So basically the vagina is acidic because of lactic acid. The lactic acid is produced by the lactobacillus, which acts on the desquamated vaginal epithelium. So you alter this balance somewhere and you find that infections are rampant. And in case you tend to be pre-diabetic or you have a termination of pregnancies, abortions, or procedures done on the vagina or something like that, then it gets more sort of hampered that the vaginal epithelium breaks down.
We touched upon the diet and nutrition, where I would like to also say today the vaping, the cigarettes, and the alcohol has become very normal. Very, very, the society also has accepted it.
Correct.
Specific, not necessarily in urban, even in rural, it is just.
But maybe it's the urban population which is exposed to vaping and smoking and alcohol because they think it's part of life,
Yes.
And these are the youngsters between the ages of 20 and 24 that they indulge because your friend is smoking, I want to also smoke and try it out. And once you're addicted to it, you can't come out of it. So that's the normal trend. And when you just got a good income coming in, which was not there when you're studying, and suddenly you're exposed to an environment which is, you got free cash on your hand, which you don't have to be sort of accounting for. These are small things which kicks in.
Yeah.
Pubbing, alcohol, smoking, vaping, friendships, trips abroad overnight, and you come across people who will definitely push you into that web.
Right. So how much does this kind of, not even talking about the hookup culture, just these habits of alcohol, vaping, cigarettes, does this impact fertility of the woman?
Smoking is definitely detrimental. You should not smoke at all. I don't think you should have smoking, both the male or the female, to be a part of their life. And if you are a smoker, it's disaster in the making in the long run. It definitely reduces the sperm count. You find that they land into asthenospermia. The body temperature goes up. You mess up your lungs. When we do open heart surgery, we do have a look at the lungs, and you can find out that the whole lung is black in color for a chronic smoker. The whole thing is, the pigmentation that takes place in the lungs and the pleura is phenomenal, and you find that these lungs don't work the way they should. With the amount of pollution that we have, and
already,
yes, somewhere along the way, one viral infection comes in, and you have respiratory. It's a chronic cough that the patients have.
That is what we thought. The smoking is associated with the lung health is what. But does that also impact my fertility in future?
Yeah, smoking definitely raises the body temperature. So when we have a count which is on the lower side, I mean, good old days in 70s and 80s when I was looking at infertility couple, the male sperm count was in the range of 80 to 120 million sperms per cc.
Okay.
120 million was a normal trend.
120 million.
Million.
Okay.
Now, I don't see a sample which has got a count more than 30 million. So the fertility in the male has dropped down drastically over a span of 45 years is what I've seen. So those days when I used to see the report, okay, 120, you're normal man, leave it alone. Nothing to worry about. Now if I see more than 34, my God, you're a Superman, You just,
35 itself has become
the
great.
norm. So it is drastic. I don't know whether it's evolution or whether it's lifestyle or is the generation that is coming up is like that, or the sperm count is dropped for various reasons. There's so many that are
So
there.
many reasons.
Smoking, alcohol, tight underwears, not looking after the personal hygiene. There's so many people, infertility, when we check the male out also, because we should see the male first and then the female in infertility. It's
Okay.
very easy to sort of tackle a male problem first.
Okay.
There are quite a few percentage of population where the guy doesn't even know how to make love to his wife. They have a tight phimosis. They don't keep their genitals clean. They don't have a proper, keep the area clean as such. So there is no chance for them to be understanding that this is the normal norm. And when you get a sperm count down, you find that the counts are 20 million, 10 million, 3% normal forms, and motility is down. So you have got various parameters in the semen analysis. One is the count. We need at least 30 million or 20 million to 30 million is what the fertility specialist will say. At least 60% should be normal sperms. And in those 60%, you should have at least 30 to 40% motility. Otherwise, the sperms don't go up the genital tract for a pregnancy to happen.
That energy to reach there.
The motility is what makes the sperm climb the genital tract from the vagina through the cervix, through the endocervix into the uterine cavity and move right up to the fallopian tube where the egg is waiting. So if the motility is down, count is down, the normal sperms are down, then the the husband is definitely at fault. So there is what is called as oligoasthenoteratospermia. You find that their counts, everything is in a mess.
It's in a mess. Okay.
So then there's no choice that, these people are desperate to get pregnant as such. And when they try to get pregnant, we find there's a male factor which is responsible.
Yeah, today the stats also say they both equally contribute. It is just not the men, it's just not the women, both equally
And
contribute.
personal hygiene in the males also is quite pathetic. They don't keep themselves clean, they don't retract the pubis and try to keep the smegma out of the circulation. And that's what infects the lady also.
Okay.
So if you're having unprotected sex, definitely the male partner can contribute to the vaginal health.
This topic has come again when you say unprotected, even, the condoms, they have the synthetic lubricants.
Correct.
Does that not impact the woman?
The synthetic lubricants are on the inside of the condom for the male. So sometimes the exterior also, because it's all rolled up.
Yes.
So there will be some sort of sensitivity that can happen for the lady also.
Yes.
So this lubricant is time tested and very few percentile of the women would be sort of irritated by the condom as such.
Okay.
But there are fancy condoms now, flavors and this and that.
All the more is it synthetic.
Absolutely. So that's what, there's a stand-up comedian by name Amit Tandon who gave one talk on this, and he says that there are more fruit flavors I know in condoms than what is available on my rack in this store as such. You name it, you have that flavored condom available, right? From chocolate to apricot and prunes and this and that. So this has really captured the market, and again, a stage of experimentation comes and kicks.
We don't know what is the impact. That time will tell.
Exactly.
From 120 to 35 million.
No, but this is really, very few people will know about it, but the fact that the counts have dropped is dramatic. I was doing semen analysis in 1976, 77, 78, and when you see 24, 25, 2024, 25, 26, the counts have dropped from 120 million, which is the normal sperm count of a normal human being. Now it's 30, I'll say, man, you are Superman. Don't even the lady sitting next to you can get pregnant sitting next to you.
That is okay. Okay. Now, I also wanted to ask the same question again. Okay, yes, smoking is harmful. Alcohol also, though it is normal, it is...
Alcohol in small quantum, social drinking, moderation is okay.
It all
But if
starts as
that's
social
more,
drinking.
but then it just escalates.
Yeah, but then, okay, a weekend
Party,
party, is
which-
that okay?
Well,
Does it impact infertility? I'm asking everything in terms of infertility.
we can. I don't think it'll. I mean, unless she's in the ovulatory phase and then they go and have a bam bang, thank you, ma'am. Then that's when they get pregnant and then they go for abortions and all.
That is the next level.
Yes.
First time I'll come there, because this parties is what leads to the hookup culture.
Correct.
Because they become really free and they become
Absolutely,
relaxed and they
yes.
don't have that hesitation.
Inhibitions are down.
Yeah. So that is where it starts. That we will definitely, I wanted to check. But then, so alcohol, very moderate is okay to an
Yes.
extent, because
Maybe.
today you can't take it away.
Yeah.
It has become part of the lifestyle. It has become.
But it should not become a habit that you have to have it day on day. So that's what kicks in later on. So, and parties are not restricted to only Saturday, Sunday.
it's
That's
not.
every day you may be having somebody's naming ceremony, someone's housewarming.
Just a reason.
Yes.
It was a long day.
Yeah,
I
that's it.
Yeah. And thanks to media, it has made it normal. So after a real long day, you have a bar of your own choice.
Chill
The
out
beach-
and get back.
And
And whether you get back or not is a question.
to your home or someone's home is also a question. But does it has an impact, huge
Yes.
impact, alcohol and thing. So is vaping good?
Definitely not good. You get really hooked onto it and then you feel that it's okay. I'm not smoking a cigarette and such. I'm free from hydrocarbons as
Yes.
such. But definitely vaping is detrimental to your lung tissue.
Because today in any offices, if you see, because cigarettes are banned and it is also now not so cool to an extent, vaping has become, everyone carries it.
A vape.
And it is accessible. Again, lot of flavors and lot of some things. So these younger people who are fond of this and gets addicted, thinking that it is a safer option and it is cooler, it has an impact on their vaginal health and uterus.
Definitely. As you rightly said, it gives you a high, then you lose your inhibitions, then definitely you indulge in whatever you should not be doing.
Okay.
So that is what have these group therapies and parties and
It's a mindless choice.
Absolutely. But it is, if the person can control it and to the limit that they need to sort of get the kick in with the vape, then it's okay. But if you're going to be non-stoply doing sort of day in and day out into it, then you're gone. Difficult to come out of it.
That is a habitual thing.
Yeah.
But that
One-off thing you're talking about? But that's what exactly brings down the inhibitions and brings down the barrier.
About if physically, will vaping cause my eggs to be weaker, my vaginal microbiome to be less?
Altered, yeah.
Yeah, will that happen?
Vaping will not do that as such because it's got nothing to do with the vagina. The epithelium is intact in the vagina. So what will get buggered up is the lungs, the vessels. And maybe to a certain extent, if the vasculitis sets in and you find that the blood vessels start narrowing down, maybe the blood supply to the vagina.
I'm definitely not cutting this as a short and sending this out because people will read us, oh, vaping is good, then let me, because it is not impacting my vagina, I'm okay to go.
No, but this is basically, it's a, syndrome of once you start vaping, alcohol is there. When alcohol is there, then you have a weekend party coming up and then you indulge in things and that's what is the end point. No?
Yeah. So end of the day thing, anything, cigarette, all these things should be avoided.
Best avoided. Even if you want to drink, maybe make it as a social event. Yeah, minimal, just to sort of be in the party. Smoking, definitely not good for the person's health. Vaping also is not, you get addicted to it and you can't do without it, And as you rightly said, it's just common to have it in your purse and just vape the time when you're alone. And with the ban coming in, I don't know. I mean, people are little sort of come down in intensity of smoking in the offices, in the open spaces and such. But there are people who have to have a smoke to keep themselves abreast with the times as such.
Yes. So
and you see a lot of them standing at pawn joints and where you get them and this, it's maybe style, sort of affluence to show that you have a cigarette in your hand and you say this lady. This is something which is wrongly interpreted by the lower middle class or maybe the youngsters who are just going, oh, that lady is smoking. She must be a hype,
Yes. And that too, if you're in a creative field, all the more it's taken as like
Granted.
Granted. If you don't smoke, you're
Hey, hello, where are you? You're in the wrong place.
Are you even a creative person? Unfortunately, that is the thing. Today, in MG roads, you can see it is equally both of them are doing it.
Correct.
While it impacts both, since our focus of discussion is all about women's health, I'm just asking this. The next one, you said in any day today, comparatively, the condoms are much better.
Yep.
Safer,
but
at least by the data and whatever is available and
True.
whatever you have seen. But equally, the stat says in India itself, OTC, around 37 million ECPs, which is different brands are available. The emergency contraceptive pills are sold. But this is a very huge number, 37 million in India. That
it's quite a bit.
It's a bit. So how does this impact women's health?
So here's a very important, pertinent question that you asked me, because a lot of people, they have sex the previous night and next morning they go to the pharmacy and ask for the eye pill.
Right.
Now the eye pill is a hormone which makes the endometrium shed itself and try to create a bleed that happens. So the gynecologist will never prescribe an eye pill unless you've taken a proper history.
Okay.
But the patient or the lady goes to the pharmacy who are not bothered about when you had sex or what you had sex for or what is the period that you are in on day of the period from the last menstrual period. He wants to sell his product. So he just gives the tablet and says, okay, take 2, start now, take 2 of them and you'll get your period. But the sad part of it, there are so many times that the patient may land herself with the continuation of the pregnancy. 2, she can be prone for what's called as an ectopic pregnancy. The ectopic pregnancy, when the pregnancy takes place in the tube and it continues to grow in the tube, and that is disaster in the making because you lose that tube in the bargain, even if you do whatever fancy procedure you want. So that way,
I am very now. If it is that dangerous,
yes, it is.
Why is it available?
That's the sad part. So they feel that it is better to protect an unwanted pregnancy than worry about an ectopic pregnancy. So as a doctor, I would definitely think twice, hey, hello, when was the last period date? When did you have sex? When do you take the eye pill? So that window frame as to when they had sex definitely tells me whether she's in the fertile period or not and whether the drug is going to be effective or not. Okay. Some people take it 48 hours later when it is not going to be of any use. See, that prevents the implantation of the fertilized egg into the endometrial cavity, which people think. They don't think in that fashion. They just want to get the period.
Yes.
So when they get the period, they're really, oh, thank God I got my period. I'm not pregnant. That's the first thing that they go. They don't realize the implication of taking this drug, which can still dampen their spirits by the pregnancy continuing.
Okay. Which they may not know.
They may not know. Only then they say, hello, they will have a little bleed because of the pill. But they think that's the period. But it is actually masking a normal pregnancy which is taking place in the uterine cavity.
Okay.
So then they find that they don't get the next period. Then they go to the doctor and then the doctor does a scan and say, hello, you're 7 weeks pregnant. So this is where people are sort of lost in the bargain because they do not diagnose a pregnancy in utero or in the fallopian tube, which is an ectopic pregnancy. So it's very, very dicey to give the eye pill to anybody without taking a proper history. But most of the patients they had a...
It is like buying a Dolo 650.
Exactly. The pharmacy should not issue the drugs without a prescription.
But that's not happening.
It doesn't happen at all. It doesn't happen at all.
Otherwise, the 37 million wouldn't have shown up.
Correct. So that figure is, this is a
smaller thing.
Yeah, it is not even, it's a masked figure that you're telling me. There will be much more because the people will not say that, yes, I have taken the eye pill. So many people don't tell us this information that you've taken the eye pill. It's only when later on when you keep on prodding them and probing them, they said, yes, we had sex in the month of September. I did not get my period in October. Therefore, I took the pill. But I had some bleeding on, say, day 35. And they think that's the period. But basically, it's just the breakthrough bleeding that has taken place. The pregnancy is happily continuing inside, maybe in the uterine cavity, maybe in the fallopian tube. And they come back to us later on after 2 months with a full-blown pregnancy which is picked up on the scan.
But how many percentage are coming back with this kind of a thing?
Percentage of what pregnancy is happening?
Pregnancy in the tube level.
That's one thing which worries us because we just treat them with a prescription and they send them off. And you have a volcano inside which can rupture anytime, leading to disaster for the lady. And there are times when the bleeding is so immense that the patient can be lost on the table. So the bleeding that takes place in ruptured ectopic is phenomenal. You lose about 750 to 1.5 to 2 liters of blood in the peritoneal cavity. And most of these girls are away from their homes, staying maybe in a paying guest accommodation or in a hostel.
What age group usually?
Normally between 23, 25, 27.
Okay. Because what I had when I had to little work on this topic, 14, 15 itself, they go and get this ECPs and the pills and they eating. What kind of an impact will this younger children have?
So this is what happens. So they think it's, very simple to just go and buy a contraceptive pill.
Yes.
You just pop it into your mouth and whatever has happened the last night is washed off.
Yes.
Which isn't so. It is disaster in the making because every time there are so many people who have taken 3-4 IPs on 3-4 months. And not only them, I'm talking about married couples who have one kid and they think that IPIL is the method of contraception. I mean, they're sometimes so dumb. They think that by just popping a pin, I'll get my period, I'm not going to be pregnant. They're the ones who come back with the pregnancy test positive.
Okay.
So it's not very sort of comfortable for any doctor to write an IPIL. I avoid it.
Okay.
But the point is, this is easily available like going to a coffee shop and asking for a filter coffee.
Yes.
So give me an IPIL, you just dole it out. You pay the bill and you walk off. And you pop it and then you say, oh, I've taken the pill. Last night was a bonanza for me.
So having that one, you said it just tears off the endometriosis and it has its own impact. The long term
Of the ECP?
Yes.
The emergency contraceptive pill is going to work only on that menstrual cycle.
Okay.
Once the effect of the estrogen is gone, you find that the endometrium.
What happens actually when I pop that?
It prevents the implantation of the fertilized zygote on the endometrial lining. It is a hormone which is definitely not sort of good for you to take. It prevents the implantation is one. And number two, it makes the endometrium unstable for implantation to take place and therefore it gets shed.
Okay.
So what happens is the patient, the lady who has taken the emergency contraceptive pill has a little bit of spotting or bleeding that takes place on the panties.
Okay.
And they think that they've got the period.
Yeah.
So whatever happened last night, 3 days later, some bleeding, they say, oh, I've got my period. So have fun.
All said and done, ECPs have become accessible and people are having it. One set, yes, like you said, there are problems. But there are a lot of children, there are a lot of young women who keep having it. And they don't, unfortunately, they don't get into those kind of unwanted pregnancies or situations where they have to have it in the next month or something. But what happens when a woman or a girl makes it a regular affair? Every weekend she has this and this kind of.
The most important thing that results from taking ECP is there's a hormonal imbalance that kicks in. And you find that the entire synchronization of the pituitary, the ovarian uterine axis is deranged.
Okay.
And you're pushing in a lot of hormones into the bloodstream, which is, making the ovary think, hey, hello, where did this come from? So that gives a signal to the pituitary not to secrete some more hormones. So there's a totally abnormal uterine bleeding that takes place. And this is the sequelae of taking too much of hormones round the clock. So many people want postponement of their periods and they come to the doctor and say, hey, I'm going for a tirthyata and I don't want to have a housewarming that is coming up. I asked them a simple question. Why don't you plan your housewarming based on your period? Why do you want to mess up your period? But no, I want to be very clean. I want to take the pill and therefore then I can do my puja very clearly and happily without menstruating as such. So there are some people who are adamant. So I said, look, this is going to mess up your life. If you feel that this is more important, the puja is more important as compared to your menstrual cycle being deranged, take it. But I try to avoid sort of prescribing a tablet which is going to make a mess of their ovarian cycle. It's a very delicate cycle, The thing comes from the hypothalamus to the pituitary to the ovary to the uterus. So that is a cycle which goes clockwork like the sunrise, sunset, It's, it's methodical, cyclical, and it's a chain of events that takes place. It's not one-off that you get your periods every 28 days. And it's very common these days for us to have periods once in 30, 35, 40, 45. They are oligomenoric. They have got various other problems. And you find that the menstrual cycles is not regulated. It's not clockwork.
It used to be very much synchronous with the moon cycle, but today it is not. because of, again, there are a lot of external factors, but then when it comes to the personal
The
discipline,
crux, you find they mess it up and then.
personally, the women mess it up for sure.
Yeah. And even if the doctor does not prescribe it, she knows that the happy going pharmacy next door will give the tablets without even a prescription.
Yes.
Postponement, well, take this, ma. Why do you want to spend consultation fees with the doctor? You take this 2 per day, 5 days, and you'll find that the periods will be postponed. It doesn't happen. So many times they take the tablets and still get the periods.
So what happens now?
So suppose you're traveling to some spiritual religious place and they come at a short notice. My flight is on Saturday. You come to the clinic on Wednesday and expect to give a doctor to give a prescription and to prevent and postpone the periods to next week. Sometimes the drugs don't affect the way it should, the whole...
Actually, it's good it doesn't impact.
It doesn't impact, but the point is, she will curse you because you're not a good doctor. They don't realize it's the drug which has to work in her bloodstream and affect the hypothalamus pituitary ovarian axis, which that gets screwed up, and then you can't help the endometrium if it's going to be shed out as a menstrual cycle. So they take the tablets, otherwise you have to give high doses of hormones, which is again not good.
Not good.
It's a mess of the cycles in the long run.
Okay. So if you come across a young girl who's been taking these pills every week, whenever, because of this hookup culture and the casual friendships and benefits and all these things, what would you tell her the long-term impact of going through this?
If she's chaperoned by a mother, I will tell the mother, you take care of the daughter first. You put the brakes on. See that you see that you don't give her a total free hand to do what they want. Point number one. Point number two, explain to the girl that this is not the way to sort of regulate your menstrual cycles by popping in a pill because you had sex the previous night, which is going to be messing up your long-term, the vaginal and the uterine health as such per se. Definitely gets screwed up in the bargain. So don't make it. If you're going to be so sexually active that you need to be, take the pill, which is the 21-day pill, and take it religiously every day one. Why take an emergency contraceptive as compared to OCP?
Okay.
I agree. For example, in US, there are people who start taking the OCPs at age 13, 14 because they're sexually active by that age.
Yes.
So definitely they are aware that they can take the OCP as a precaution against unwanted pregnancies. And there also it is very promiscuous that they have multiple partners in school and proms and this and that. And they are on the pill. So they are happy to go sometimes till they get married till 30, 35. You do not know when you're going to have sex with whom. Okay. So with that pretext or condition background, they take the pill as a OCP which continuously regulates your menstrual cycle. You know when you're going to get your periods. The flow is always lesser than normal. And the cramps that are associated with the periods is gone. So it makes life comfortable for a 25-year-old lady to have regular cycles. 2, to plan their events, whatever they need to do. 3, there is no dysmenorrhea. And 4, well, you're protected. You can have sex whenever you want.
Is it like the problem of awareness? So does people here in India doesn't know that there is an OCP and hence they are just reaching out to the ECPs?
Even if they know about it, they don't bother about it. There's so many people we tell them, look, please prevent a second pregnancy immediately after the birth of the first one. We tell them, look, take some contraceptive measures. Either take the pill or take the condom or put an IUCD in situ or see that you're careful and timing. But this timing business doesn't work. So many of them, even after 3 months of delivery, they come back shamefully, says, dog, there was an accident that happened. I said, what, road traffic accident? No, I'm pregnant. That's what they tell us. And then I said, why didn't you use a contraceptive measure? Best is to put an IUCD. Safe, predictable for next 2 years. If you don't want to have a kid, just put an IUCD. It takes hardly 30 seconds to put a copper T inside. And that will protect them for the long run without taking any hormonal therapy as such. 2, use condoms. You are aware of condoms. You know what it is. You can use a condom. They always say, no, we use condom, but there's still an accident. So how the hell these accidents happen, I don't know. But they come back pregnant 3 to 6 months after the first delivery. And then they come...
I have this copper T, which you said it is just a best protective measure. But the women,
in between pregnancy.
In between pregnancy. Yes. Oh, not for the younger.
Not for the... there are people who are sexually active, who don't want to take the pill. I want to have normal sex without using a condom. They ask for a copper T. So we put.
Okay.
So once the vagina, the hymen has been torn because of sexual escapades earlier, it's very easy to put an IUCD. It doesn't take time.
Okay.
But if you have a virgin, then it's difficult to put a speculum and put the copperty. So there are some people do have, intact hymen, and they say we want to be sexually active henceforth, please put some measures. So I'll tell them, use the pill for some time. Once your vagina has become little loosened, then we'll put a copperty if you want to still not get pregnant. Or if you're going to have fun and games for the next 5 years, put a copperty so that you protect an unwanted pregnancy.
And no hormonal disruptions.
Exactly. But this way, they will encourage themselves to multiple partners.
Yeah.
And they may not get pregnant, but infections are more common amongst this group.
Oh, so it is a different challenge.
Different challenge in the long run.
Pregnancy is
Avoided.
But then there are other challenges.
So you can have sexually transmitted diseases like gonorrhea, syphilis and chlamydia, which is the most important thing, which can protect, which can damage the entire uterine cavity lining as such.
How will a young woman know that she has a STI, sexually transmitted infections?
The commonest thing is they have discharge, which is more, proficient as such as compared to prior to their infections. They'll find there'll be profuse vaginal discharge. This discharge is associated with burning, and this discharge may be associated with itching. So when they find there's a lot of itching taking place or burning taking place, they do come to the doctor. And excessive profuse discharge, which sort of stains the panties. I have to use a panty liner all the time, and this discharge is making my life miserable. I need to scratch myself in public. So it becomes a social stigma for them that there's something wrong, and then they come to the doctor.
Okay.
And when we examine them, the commonest thing that we find is what is called as a non-specific vaginitis, or what is called as Gardnerella vaginalis, along with candidiasis. These are three things which we see. But chlamydia is there, but we cannot diagnose it, and it's difficult to do it as a laboratory investigation. So we give a gunshot therapy to cover up all the three.
It definitely sounds Greek and Latin to me, whatever you said. Basically, so a woman, when she has some uncomfortness in her private parts, that is where she reaches out. And that is where you get to know whether it is a STI or it's a simple yeast or a bacterial infection or some because of the products.
The sexually transmitted infections are only detected by blood tests.
Oh.
So you need to do your VDRL test, you need to do your HCV. All these tests, HIV, if you do, then we know that you've got sexually transmitted disorders as such.
So otherwise, a doctor will not know?
No, but we will, when we see the vulva and the vagina, and we can see that the hymen is torn and lacerated, that she's sexually active. And when we do a speculum examination, we can look at the cervix and find out where the discharge is coming from. Is it coming from above, coming from the cervix, or is it coming from the vagina? Okay. So in candidiasis, you'll feel that there's a lot of discharge in the entire vaginal tract. These are all something like, curdy white patches. And when you take them off, there'll be a red sort of bottom line there. And these people have intense burning and itching that happens. So we can make out a candidal infection just by looking at it. You don't have to take a swab and do a culture sensitivity. We give them broad spectrum antifungals and they'll work.
Okay.
The second set of infections is leukorrhea, is because of Gardnerella vaginalis, wherein the discharge, or trichomoniasis, which the discharge is greenish yellow in color, profuse, watery, thin, smelling like, rotten fish.
Okay.
So then we know that it's a mixed infection between trichomoniasis, G. vaginalis, and non-specific vaginitis. So we give broad spectrum anti-fungal infectant plus antibacterial and gunshot therapy, which clears off the infection.
Okay.
But we must see to it that they treat the male partner also. That is where it is missed.
Okay.
So if you don't treat the male partner, the next episode of sex will get the infection back. So that's called as ping pong diplomacy. You treat only the female and you don't treat the male. The next bout of sexual contact that they have, the male infects the lady again, and they come back to the doctor. You gave me a prescription 3 months back. Look, it's back again.
Because the man is not treated.
Exactly. So when the man is treated simultaneously with the same set of tablets for the male, then hopefully the infection does have a remission for about 6 months to a year. But it will come back.
Okay, this happens in a very nice familial setup where they think. But what happens when the women are exploring and have multiple partners?
That's exactly. So the male will never have symptoms of STD.
Oh,
So
no
it,
symptoms.
in the sense they don't have itching or burning or something, but they will have discharge in the smegma may be more accumulated behind the penis
Okay.
and on the penis behind the prepuce. If the guy is not hygienic and does not keep his penis very clean with soap and water and keeps it exposed to, I mean, pull the prepuce back, then you find that these people harbor a lot of smegma. Smegma is the white discharge which is there behind the prepuce of the penis, the penis.
Okay.
So the prepuce has got this smegma, and when they have sex, the prepuce pulls back, and the smegma is deposited in the vagina.
Okay.
And the vagina, though it is acidic, the acidity may not be able to combat the amount of what should I say, smegma which is deposited or the infection that is deposited by the male. Comes the second guy, it adds on to the
Things. And the girl also can transmit it back.
partner also.
Also, okay.
But the problem is, see, the vagina is a closed dead space. It is dark, it is moist, it is wet.
Yes.
And there is, no atmospheric air going inside. So there's an anaerobic chance of, that means less of oxygen. That's called as an anaerobic atmosphere. So a damp, moist, wet, with a lot of glycogen being there, it predisposes the patient to having a vaginal infection, especially premenstrually or when they are pregnant.
Okay.
In pregnancy also, we have a lot of people having this white discharge. Basically, it will be candidiasis because there's a pelvic congestion. The vagina is having a lot of transudate and there is a wet, moist, pregnant vagina. Therefore, you'll find that the infections are very much prone to be happening during the first trimester, second trimester, and third trimester.
Okay.
So if a lady tells us, look, I'm having extra white discharge, we say, yes, it's part of pregnancy. But when she tells me, no, I'm having itching and burning, we know there's infection. So we do a speculum and see. And we can make out that this is definitely fungal or this is trichomoniasis or this is non-specific or this is just bacterial vaginosis.
Okay.
So, but then whatever it is, we need to treat everything. So we have got treatments now which is all incorporated in all in one.
Okay.
So 3 in 1, like, you buy one, you get 2 free. Like that it comes. So we can clear up all the infections as such per se.
Okay.
So basically it is fungal.
But still it is, you have to treat the partner and also this. Otherwise it will be recurring.
Yeah, but if you have multiple partners, then you're
Gone case.
difficult.
Very difficult.
So that's called as contact tracing is to find out where the infection came in from. Whether it was guy A on Monday or it was guy B on Wednesday or guy C on Saturday. You have to do what's called as contact tracing. So you find that when did this happen, from how long you've been having it, who are the guys involved, is it only one guy, is it multiple partners? This is what you need to take a proper history from the patient.
But is this, whatever we are discussing, is it really practically happening?
It's happening quite a bit.
Are we not exaggerating?
Not to the extent that we have, one person per day, but they do try to experiment. 1-2 is quite a norm.
Okay. Because this one night stand is a culture which is like, people think it's harmless.
Yeah, but it isn't.
It isn't. Because of all the
things,
challenges.
And you do not know the guy as such, how good or how clean is and what is his antecedent history as such. So that can sort of proliferate.
Those, how clean, how hygiene, all these things doesn't come because these are inhibitionless emotions and inhibition time. Like, okay, let's go enjoy, explore. It is like...
True.
So they wouldn't even have time to
Think about it. Yeah.
It is not that arranged marriage and the Shanti Muhurta where everything has been so divine.
And with all the video clips visible to you down the line, you can download any amount of pornographic material. They see that they don't understand the circumstances under which it is filmed. They think, oh my God, they're having sex for 10 minutes, which is possible. So this guy perform more than 30 seconds, so let me try the other guy,
Okay.
This is where multiplication comes in because they are not content and satisfied with the partner that they've chosen.
Because
they would like
they
to
don't know what is the objective or what is that they're looking for.
Yes.
Because they see something which is edited and done, couple of clips together and think they don't know that. And so they think 30 is less, let me try a guy who can do it for 1 minute, 10 minute types. And that exploration is where... So here also, I'm again, disclaimer, we are not exaggerating. These are all practically that is happening. And in your experience, you see cases like
Definitely, we see them, because not very greatly, but, but when they are infertile and you take a proper past history, you get this information from them. They do tell us that, yes, I had a partner earlier and that one partner, we mentally tick off, so it could be multiple partners.
So
When you have this infection which is florid, when you find that, they're pouring out discharges and such. So definitely we know there's something going wrong somewhere. And these people must be taking sort of gunshot therapies as such, and that doesn't work, because if they change the partner, the second guy may just infect her again.
yes.
And then coming back to the primary doctor who's treated and say, hey, hello, your treatment has not worked, they go to the next doctor.
Yes.
And the next doctor thinks this is the first episode that she's having, not knowing the past history of the lady.
Yeah.
So this
It
is
becomes
where
embarrassing for the girl to
come back to the original doctor.
yes,
So this
because
is
third time I'm coming, then obviously the
so many
judgment.
times. Not only vaginal, but even the bladder health, they tend to develop a lot of urinary tract infections as such. The urethral opening is very close to the vagina. So there also it is the columnar epithelium which is there, which is prone to hostile environment as such.
Okay.
So the infection can take place in the urethra, you can be in the bladder. So they can develop what is called as cystitis and urethritis as such. And they come back for treatment. And then we ask proper history. Yes, I was sexually active. It was quite a tough one that we had. And not only them, the married couples also come back with what is called as honeymoon cystitis. The first time she's been a virgin, they have rampant sex, what should I say, no control on themselves, and they have
rough and
tough sex as such that can predispose them to what is called as honeymoon cystitis. They have
Oh.
immense burning when they pee, and they find that the urethra has been sort of crushed against the pubic bone, and therefore they have this. It's a known entity. It's called as honeymoon cystitis. So a newly married couple, you'll find they have a whole lot of red bangles and white bangles, and they come. And we have come from north, and we have come here to Bangalore to see all the Brindavan gardens and this and that in Mysore. And I'm having a difficulty in peeing. So we just ask them, how long have you been married? Oh, 15 days, sir. So when they tell us that, we know that this is nothing else but urinary tract infection. And there, they are sometimes not gentle. They want to show their manpower. And then things go wrong,
Okay.